This is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 4 minutes after 11 o'clock. Thank you for tuning in. Dr. David Frankel is on the phone. Dr. Frankel is an assistant professor of medicine at Penn Medicine and the director of the Clinical Cardiac Electrophysiology Fellowship Program. He's on the phone to talk to us about the symptoms of atrial fibrillation and taking note of stroke risk. Those of you who know us know that Patsy, who was a big part of our station for a very long time, Patsy Martone, passed away earlier this month, the very beginning of this month, and she had a stroke, I guess it was New Year's Day.
Yes, New Year's Day
and then
evening.
she passed away 2 days later.
Yes.
So it's super serious, and this topic hits close to home because of losing Patsy. Dr. David Frankel, good morning, sir. Thank you for being on the show with us today.
Good morning. It's a real pleasure to be with you.
Where are you? Where are you calling from?
Philadelphia.
Where you got a lot of great doctors in Philadelphia. Seems like a lot of our doctors that call us are up there in Philadelphia. What is atrial fibrillation? Can you help define what that is so I understand it?
Absolutely. So atrial fibrillation is an incredibly common heart condition that affects nearly 7 million Americans. And what it is an irregular heartbeat where the top of the heart, the atria, instead of effectively pumping blood, it just fibrillates or wiggles. And because it's not effectively pumping, blood pools in the atria. And when blood pools, it can form a clot. And if that clot breaks off, it can cause a stroke. And so that's really the potentially devastating consequence of atrial fibrillation not caused by a heart valve problem. And that's what I'm here to talk about today.
And does the clot have to be stuck somewhere, or like in the brain or the heart, or can it be stuck anywhere to cause problems?
Yeah, so if it stays in the heart, believe it or not, that's the better scenario. But once it breaks off to the circulation, then it's going to cause trouble. And the most common place for these clots to go is to the brain, and then that can cause a stroke. And what's interesting to know is that strokes that are caused by AFib tend to be the most devastating, the most disabling, the most likely to be fatal, because they tend to be very large clots which damage a large area of the brain.
Really?
But clots can also break off and go to other organs. They can go to the gut or to one of your limbs. So all sorts of bad things can happen.
If a person was taking a blood thinner and they did not know they had atrial fibrillation, and a clot did form in spite of the blood thinner, would the blood thinner and the clot, would that combination be like really dangerous? The two things together?
Yeah. So thanks, Larry, for bringing that up. You know, the blood thinner is really what we're here to discuss today. What I'm here to discuss today, and taking a blood thinner is one of the best options if you or a loved one has atrial fibrillation to reduce your risk of stroke. That's the way to break this cycle that we're talking about with the clot forming and then breaking off. And so not only are blood thinners effective at reducing the likelihood of forming a clot, but if a clot forms, it tends to be smaller. So taking a blood thinner reduces your risk of stroke, and if you are having a stroke despite the blood thinner, that it tends to be a smaller, less disabling stroke.
Wow. And I'm guessing is that easy for a doctor to determine if you are going in that direction?
Yeah, so, the first step is to diagnose atrial fibrillation. Unfortunately, too many patients learn that they have atrial fibrillation when they already are presenting with the stroke. That's their first quote-unquote symptom, and in a sense, it's too late at that point. And so, the first step is to diagnose atrial fibrillation. So I would certainly encourage your listeners, if they're having symptoms of palpitations or lightheadedness or getting breathless when they exert themselves, to get checked out by their doctor. And then if indeed they do have atrial fibrillation, then to have a discussion with their doctor about how best to reduce stroke risk and whether a blood thinner would be right for them. Now, of course, every treatment in medicine has potential downsides as well, and for a blood thinner, they increase the risk of bleeding, and that's why the decision needs to be tailored with the physician based on the patient's risk for having a stroke, risk for having a bleed, and then they can choose the right treatment together.
Is that risk inherited?
That's a great question. There is a genetic predisposition to atrial fibrillation, but it's not as strong as my parents had brown eyes, so I have brown eyes. It's a more complex inheritance where there are a number of genes, each of which increase risk slightly for developing atrial fibrillation. But the good news is there's a lot of lifestyle decisions and treatments which can really reduce your risk for developing atrial fibrillation. So here's what they are. The most significant risk factor for developing AFib, not caused by a heart valve problem, is getting older. And of course, there's nothing we can do to stop that. But what we can do to reduce our risk of developing AFib is maintaining an ideal body weight, exercising, controlling blood pressure, controlling diabetes, not smoking cigarettes or drinking excessive alcohol. And by doing all these important lifestyle treatments, you really can reduce your risk of developing atrial fibrillation significantly.
I wanted to ask you about exercise. If you have AFib and start exercising, is it, like if you didn't know you had AFib, I mean, isn't it possible that you could aggravate it with the extra? If you're causing your heart to work harder because you're jogging or something, wouldn't that be a problem?
Yeah, it's a wonderful question, and the answer is yes and no. So it's one of the paradoxes of exercise, that it is true that in the 30 minutes that you're on that treadmill, you may be more likely to go into AFib than the other 23 and a half hours that day, because a lot of these arrhythmias are triggered by adrenaline. But your overall risk of having arrhythmias is reduced dramatically because exercise is so healthful in so many ways. And so for our arrhythmia patients, and for that matter for our patients who have heart failure or coronary artery disease, all of our cardiology patients, with very, very rare exceptions, we encourage them to exercise as much as possible.
And the good nutrition also plays an important role.
Absolutely. So we've published some nice research here, specifically after a procedure that's called AFib ablation, that maintaining an ideal body weight and increasing your level of fitness by 10% or more both have hugely important and independent benefit for reducing risk of having more atrial fibrillation.
So go ahead. I'm sorry.
Sure, and if I may, I just want to mention the campaign. So Bristol Myers Squibb and Pfizer have teamed up with the National Stroke Association and iHeartMedia to create this Tune In to AFib, Take Note of Stroke Risk. And I'm speaking on behalf of the program today.
Okay.
And basically, this is an educational campaign. We've made a great website, tuneintoafib.com, where if you visit this website, you get to listen to exclusive concert footage from Southside Johnny and the Asbury Jukes, and there is a quiz to take, and if you take that quiz to assess how tuned in you are to AFib, you'll learn a lot. For every person that takes that quiz, Bristol Myers Squibb and Pfizer will donate $1 to the National Stroke Association, up to $30,000. And when you complete the quiz, then you get access to even more exclusive concert footage. So it's a great show, and you can learn a lot from the website. And so we would encourage your listeners to check out tuneintoafib.com.
So Zoot Suit Riot won't give me a heart attack then, right?
Right.
Just hearing that song again. I haven't heard that song in years.
Yeah.
How did they, what's the connection between what's the name of the group again?
Oh, there's Cherry Pop
Southside-
Daddies.
Oh, I had said the wrong name. Oh, Southside Johnny. Oh, I know.
Southside Johnny and the Asbury Jukes.
Oh, I know. Okay, I was thinking of the wrong group. Okay, that's the. Won't you come to Florida for a vacation? Isn't that the
Oh,
song?
there you go.
Yeah.
Sorry, you should be thinking of Jersey Shore and Bruce Springsteen.
Gotcha.
That's kind of
Yeah. Now I know
the
you
genre.
Oh
Yeah.
my gosh, I'm so glad to hear their name again. Well, Doctor, thank you for being on the air with us today. The website that you gave us is, I just went to it, tuneintoafib.com, AFIB,
That's it.
AFib. Dr. David Frankel, thank you. That was good information, and now I can't. You lured me into it. Now I can't wait to see Southside John. What is that?
Fantastic. I'm sorry.
I was just trying to think of the name of that song. I'm so anxious. I think is the name of the song.
You'll figure it out.
Thank you, Doctor.
Thank you so much for having me. Have a great day.
All right, you're welcome. All right, we will take a little break and we'll be right back. You're listening to The Source, WOCA Ocala.